Do you have a family history of high cholesterol? Or maybe you've heard the recommendations from the American Academy of Pediatrics to check cholesterol in children as young as 3 and are wondering why? This episode today is for you.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome back to Be Kind Pediatrics. For those of you who are new to the show, my name is Dr. Blair Rolnick. I'm a board-certified pediatrician and mom myself. Today, I want to talk about one of the topics that's really important to me because I feel like it's a topic that might be a little bit overlooked. So I want to talk today about cholesterol in children and why it matters and what every parent should know. As pediatricians and parents, I think we so often focus on major milestones in our patients' and child's lives, like first steps, first words, school achievements. But there are also important health concerns that I feel like sometimes get overlooked, and one such issue is cholesterol. A lot of parents say to me, well, isn't cholesterol really an adult problem, and why are we worrying about it, and why should we be thinking about it in our kids? So I think to answer that question, let's take a little bit of a dive into what is cholesterol, and then we can kind of go from there. So cholesterol is a type of fat that is found in our blood, and it's definitely not bad. We are supposed to have cholesterol. Your body needs cholesterol to build healthy cells. But too much of it is what really causes a problem. Cholesterol comes in many forms, but the two main forms, what we call LDL cholesterol and HDL cholesterol. LDL cholesterol is that low density lipoprotein, also sometimes called bad cholesterol. And HDL is the high density lipoprotein, also sometimes called good cholesterol because it removes LDL cholesterol from our bloodstream. So now let's talk about why cholesterol is a concern for children and why we should be thinking about it as pediatricians and not just adult doctors. So one of the most important things we do as pediatricians is preventative care. Really, our job is to deliver our patients into adulthood as healthy as possible. In the US, the leading cause of death and disability is cardiovascular disease, so things like heart attacks and stroke, which most often arise due to complications of things like high cholesterol. So you may think that high cholesterol is really an issue for the adults, but in fact, the disease process starts much earlier, and we know that it starts in childhood. So you could argue actually one of the most important preventative care strategies that we should be implementing in our pediatric environment and care is really screening for high cholesterol, identifying it, and treating it and intervening early. So how do we really know this is a pediatric issue? So we started to really realize that this was a pediatric issue during the Korean and Vietnam Wars. During that time, healthy, thin soldiers underwent postmortem autopsies, and one of the things that they noticed were that these soldiers actually had coronary artery plaques, which are the precursor to cardiovascular disease like strokes and heart attacks. Since that time, we've only added on to our data and really shown that risk factors like high cholesterol and high triglycerides truly are associated with cardiovascular events in midlife, not even in elderly life. So we know that it's a problem. How do we know it's a problem for what kids, and what kids should we be testing for high cholesterol? One of the issues with high cholesterol is it really doesn't have any obvious signs or symptoms. So we don't really know that you have a problem with cholesterol until you've had a cardiovascular event later on in life. That is why it's so important actually for us to be screening appropriately at younger ages. So what are the current recommendations? So the American Academy of Pediatrics, or the AAP, actually recommends a universal cholesterol screening for children between 9 and 11, and then again between 17 and 21. We typically do not screen between 11 and 17 because during that time, during puberty, which is the median time for children to be going through puberty, things like testosterone can actually falsely lower your cholesterol. So if we test during that period, we might get what's called a false negative and assume that a child has a normal cholesterol when it is in fact actually elevated. There's actually an important second part of this recommendation, which is that the AP also recommends selective screening for children over the age of 2 who have certain risk factors. Those are children who have a positive family of high cholesterol or premature heart disease. So certainly if a parent has high cholesterol or a history of a heart attack or stroke, but definitely if you're noticing you're going through family history, you're noticing it's like an aunt, an uncle, a grandparent, a great-grandparent, and maybe not one of those not one of the parents, that's still a positive history. Or if a patient has risk factors for heart disease, such as high blood pressure, diabetes, or smoking. So we don't usually see smoking, luckily, so much in the pediatric population, but definitely high blood pressure, diabetes, prediabetes, and obesity. Why does the AP recommend this? And why am I so passionate about it? So the AP recommendations are really based on research that shows early treatment and early intervention of cardiovascular risk factors in pediatric patients is really effective at preventing those midlife cardiovascular events. 2, it's incredibly common. About 1 in every 250 people has a genetic risk factor for high cholesterol. We're going to talk about that more later on. And we're also seeing increasing rates of obesity, which is a risk factor for high cholesterol. And we're going to talk about that again later on. 3, we used to do selective screening. So we only screened those children who had risk factors. And we found that 30 to 60% of children who actually have high cholesterol or dyslipidemias are missed with selective screening. And then 4, testing is really simple. You can use a simple blood test. You can either do a venous test and test for high cholesterol. Your child does not have to be fasting for the first one. Or 2, some offices like ours use a point of care test where we actually just need a little drop of blood from a fingertip as a screening test. If the screening test is abnormal, we will bring your child back for a fasting venous sample, but it can be as simple as a non-fasting finger stick in the office or a blood draw. We have tons of techniques now to make blood draws more comfortable for children. So we can use topical anesthetic agents like lidocaine. We can use buzz bees. We can use freezies. We can use distraction techniques, virtual reality, iPads, all sorts of things to make sure that when we do this one blood test, it's easy and comfortable for our patients, but it's also an important part of their healthcare maintenance. So why aren't kids being screened more regularly? I think one of the major barriers is a lack of knowledge and understanding of the importance of early intervention, both on pediatrician side and parent side, and a lack of understanding what they can do about it. And 2, maybe a little bit of a fear of the venous blood draw. But like I said, we do have other strategies for checking this, including finger prick samples. So I think this really leads naturally into the next question, which is why are we seeing high cholesterol in children? And if my child is thin and healthy and has an exceptional diet, should I really be concerned about this? So in many, many cases, the cause of high cholesterol in children is actually genetic. If parents or close family members, again, have a history of high cholesterol or heart disease, the child may actually be at risk for this. This is called familial hypocholesterolemia. Certainly when it is homozygous, meaning you have 2 copies of the gene, your cholesterol is very high, and that's fairly obvious. But about 1 in every 250 individuals has a heterozygous mutation for hypercholesterolemia. And their lipid levels might not be crazy high. They might be in like 150s to 190 range. But 1 in 250 means that every pediatric clinic is going to have a few of these patients. And certainly they are out there in their community. And so it's really important for us as pediatricians and as parents to be aware of the fact that if we have a family history of high cholesterol, that we should be screening our children earlier and intervening earlier on high cholesterol to prevent these cardiovascular events in their midlife. So certainly number 1 contributor to high cholesterol in children is going to be genetic, but definitely also diet, exercise, and obesity. So lifestyle risk factors are also risk factors. So our diet has vastly changed in the last couple of decades. We are having diets that are higher in saturated fats and trans fats, which raise LDL cholesterol. And we are seeing childhood diets that are much higher in processed foods, ultra-processed foods, which again tend to have higher saturated fats and lead to higher levels of LDL cholesterol. 2, we're seeing less physical activity, not just at the familial level, but also school activities, etc. We're using more screens and more computer screens and more at-desk behavior. Also, the way that we let our children play has changed dramatically since the 1920s, 1950s era, where children used to go outside and kind of play like capture the flag until the sun went down. We are in an environment where unfortunately that's not always safe anymore. And so we have a decrease in activity in this young age, which can help LDL levels creep up a little bit. And then, obesity, which is certainly a risk factor for high cholesterol. We are seeing increasing trends in obesity in children. I want to pause here and talk about obesity a little bit more for a moment, because I think there is a misconception that obesity, 1, is the most common cause of high cholesterol, and 2, that the cause of obesity is due to a lack of willpower, poor diet, or control on the child or parent's part. So 1, the first misconception, which is if a child is diagnosed with high cholesterol, it must be because they're obese. The vast majority of children who have high cholesterol are not obese, actually. The most common cause of high cholesterol in children is by far that genetic contribution. And then 2, I think the misconception that if a child is obese, it is because they somehow lack the willpower to control what they're eating. So I do want to go through a little bit and talk about obesity in the United States and in our pediatric patient. So there was a study published in the New England Journal of Medicine that looked at obesity rates in both adults and children according to year. And I really like this graph in particular because it shows really nicely that in the pediatric population, the rates of obesity have been steadily increasing in prevalence really since the 1980s. If you look further back, like 1920s to 1960s or 70s, we really didn't have good epidemiologic data on the rates of obesity. But since we've had better records, we've seen a slow and steady increase from the 80s until now. Across all ages. So it's not just our pediatric population. Here you can see obesity in adults according to years. And again, there's an increase across all groups from the 1980s kind of steadily on into the 2000s. And then this last one looks at, again, rates and prevalence of obesity between males, females, globally, and socioeconomic statuses. And again, you can see here across all socioeconomic statuses, across both genders, both globally in the US, obesity rates really seem to have increased in prevalence since the 80s. And so whenever you're seeing a trend like that across multiple groups, multiple socioeconomic statuses, that it goes against the fact that really this has to do with not being able to control what we eat or having poor willpower control, that something else is going on that is a barrier or causing the change of the increased rates of obesity. And so again, I think there are a couple factors contributing to the obesity trends, but particularly in children, the obesity rate really has gone up to around 20%, 15 to 20% of our children are obese. And again, that rate has increased across all genders and socioeconomic statuses. And I think there seem to be a few factors contributing to these trends. One, again, a change in diet. So increased consumption of low nutrient, high calorie dense foods, which are ultra processed and high in saturated fats. 2, a shift towards more sedentary activities. So increased screen time use and less playtime outside. But again, in general, kind of a shift away from physical activities towards more sedentary lifestyles. While obesity is certainly a contributing risk factor for cholesterol, probably the one we should be focusing on most as pediatricians and parents really is this hereditary high cholesterol. So how can you help your child maintain healthy cholesterol levels? So while I said I think the main contributor to high cholesterol in children are not probably the lifestyles, lifestyle is still the number one treatment or way that we can help our children combat high cholesterol or lower high cholesterol if they have it, especially that LDL or bad cholesterol. So there are several dietary-based and lifestyle-based interventions for high cholesterol, and we're going to go through them all, but I do want to put a plug out here that if your child has high cholesterol or if you have a family history of high cholesterol, it can be super helpful to get a registered dietitian on board early to help set up some of these lifestyle changes as a habitary change. So one thing you can do is increasing fiber intake in your child's food. So you can add things like fruits, berries, oats, vegetables into their diet. There was a study in the American Journal of Clinical Nutrition in 2014 that showed consuming about 5 to 10 grams of soluble fiber can lower cholesterol about 5%. And that is because insoluble fiber really binds cholesterol in our digestive tract and prevents us from absorbing it into the bloodstream. Another thing you can do is incorporate plant-based sterols into your food. So just increasing the number of plants that your child is eating. Again, there have been studies that have shown consuming about 2 grams of plant sterols can reduce your LDL cholesterol by about 5 to 15%. So plants in general are a great idea. If you have a child with high cholesterol or family member with high cholesterol, I'd say, let them have a normal plate of food or their typical dinner whatever you're making. But before they reach for a second of anything, try to encourage them to reach for more plant-based foods as a secondary, as a second portion on their plate. 3, you want to focus on healthy fats. So replacing saturated fats with monosaturated fats. So avoiding things like ultra-processed foods, and increasing your monosaturated fats, things like olive oil and avocados can help lower your LDL cholesterol. This really comes from a study that was published in Lancet in 2017 that found replacing saturated fats with unsaturated fats really reduces the risk of cardiovascular events. This is where that Mediterranean diet, which is super rich in olive oil and fatty fish, comes in playing a role in reducing cardiovascular events. 4, think about increasing your omega fatty 3 acids. So these are going to be things like salmon, sardines, or supplements, if that's not on your menu. So they have been shown to reduce triglycerides and lower LDL cholesterol. That really comes out of the Journal of Clinical Epidemiology in 2015, which found that adding omega fatty 3 acids can reduce triglyceride levels by, again, 15 to 30%. So this can be a really helpful intervention. You want to aim for including fatty fish in your diet at least around 2 times a week to obtain sufficient omega-3 levels. And then adding things like more seeds, nuts, and increasing antioxidant-rich foods. Again, those are going to be your fruits and vegetables. There are studies that have shown that both of these interventions can lower your LDL cholesterol because, again, it kind of helps bind that cholesterol in your gut. The fibers in the fruits and vegetables and the antioxidant-rich foods binds that bad cholesterol in your gut and reduces its absorption. And 2, the plant-based foods tend to be a good source of monosaturated fats and a good replacement for those saturated fats, which can be a source of bad cholesterol. Since we were talking about dietary interventions for high cholesterol and causes, I do kind of want to talk about the misconception also that if you somehow eliminate meat from your diet and go to a totally plant-based diet, or you've been on a plant-based diet and you are not obese and you don't smoke and you don't have hypertension, that means that you have no risk factors for high cholesterol. Because, like I said, 1 in every 250 patients is going to have a genetic risk factor for high cholesterol. Typically, what that gene mutation causes is an inability for the cholesterol to move from the bloodstream into the cells for the cells to use the cholesterol as the building blocks they need. So those patients just cannot move cholesterol out of their bloodstream and into their cells for use. So it really doesn't have a lot to do with their diet. And by the same token, it also means that dietary interventions are typically not sufficient alone enough to lower that cholesterol. So those patients who do have familial hypocholesterolemia are even more important to pick up because they really need to have being monitored closely to see if they need to start a statin or another cholesterol-lowering medication. The last thing I want to talk about is medication needs. So in many cases, lifestyle changes alone may not be enough to bring a patient who has certainly a genetic form of high cholesterol completely under control. And so sometimes we do put these children on medications like statins. The good news is that statins have been shown to be very safe, and we've been using them for a really long time. So I just want to conclude by saying, cholesterol in children is definitely not something to panic about. We're not trying to generate mass panic with this, but it's something to pay attention to. And encouraging and being aware of our family history can be really helpful for both our children and actually us as parents. Regular checkups, making sure you're getting these screenings done, a good balanced diet, trying to focus on whole foods and physical activity are important, not just for our cholesterol, but our overall health, well-being, and mental health. And so there's lots of reasons to be paying attention to these things in our patients and our children as well. I hope overall that you found this episode helpful and empowering. If you have any questions, please leave them below.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.